In this video, we're going to talk about seminal vesicles and the prostate gland, including their location, their function, and some common diseases that affect them. At the end of the video, I'm going to show you how these two structures are affected by a specific medical condition. Make sure to subscribe if you don't want to miss any of my videos, so make sure you watch until the end. In fact, they wrap around the upper part of the urethra like a cuff. They are approximately 2 inches or 5 centimeters long. It's important to note that the seminal vesicles are not the same as the vas deferens. This blockage can lead to a buildup of fluid in the seminal vesicles, causing them to swell and expand. Its primary function is to produce a fluid that nourishes and protects the sperm. This fluid makes up about 30% of the semen volume. This is a condition in which the prostate gland enlarges, which can cause symptoms such as difficulty urinating, a weak urine stream, and frequent urination. BPH is common in men over the age of 50, and it can be treated with medications that reduce prostate size or improve urinary symptoms. Watch this video where I explain what type 1 and type 2 diabetes are, what causes them, and how you can prevent them. The prostate fluid contains enzymes, proteins, and other substances that help to nourish the sperm and protect them from the acidic environment of the female reproductive tract. When someone has diabetes, they have high blood sugar levels. Over time, this can cause damage to the blood vessels, including those that supply blood to the seminal vesicles and the prostate. As a result, the seminal vesicles may begin to shrink in size and the prostate may become enlarged. Both of these changes can cause problems with fertility and urinary function. In addition, high blood sugar levels can also directly affect the function of the seminal vesicles and the prostate. For example, it can interfere with their ability to produce fluids and enzymes that are necessary for healthy sperm and may lead to inflammation or infections in these structures. This can further contribute to fertility issues and make it more difficult to urinate. It also plays a role in semen clumping, helping to solidify the semen after ejaculation. Symptoms include pain and swelling in the testicles, as well as difficulty urinating. Prostatitis is inflammation of the prostate gland, which can be caused by a bacterial infection, but it can also be caused by non-bacterial factors such as anatomical abnormalities or genetic predisposition. Symptoms of prostatitis include pain in the pelvic region, difficulty urinating, and a burning sensation during ejaculation. Treatment depends on the underlying cause and may involve antibiotics, medications to relieve pain and discomfort, or other interventions to improve prostate health. Treatment options may include surgery to remove the blockage or other interventions to restore normal fluid flow. One of the most common diseases that affects the seminal vesicles is inflammation of the seminal vesicles, also called seminal vasculitis. This inflammation can be caused by a bacterial infection that spreads from the urethra to the seminal vesicles via the ejaculatory duct. Symptoms of seminal vasculitis include pain during ejaculation, difficulty urinating, and a burning sensation in the lower pelvic region. Treatment typically involves antibiotics to combat the underlying infection. The vas deferens is a tube that carries sperm from the epididymis to the ejaculatory duct during ejaculation. The seminal vesicles lie alongside the vas deferens, but they are not part of it. If you're new here, I am a medical doctor and I make weekly medical videos to help you become a medical expert in your own life. So let's start with the seminal vesicles. The seminal vesicles are a pair of small organs located behind the bladder and underneath the uterus or the prostate in men. The primary function of the seminal vesicles is to produce a yellowish fluid that nourishes and helps transport the sperm. This fluid makes up the majority of the semen volume. It contains several important components, including fructose, which provides energy for the sperm, as well as substances that help to activate and enhance sperm motility. Seminal vesicles also play a role in semen clumping. Clumping, or what we call coagulation, is an important process that occurs after ejaculation. It helps to solidify the semen into a jelly-like consistency, which allows it to stay in the female reproductive tract and prevents it from leaking out. This is essential for successful fertilization. Diseases of the seminal vesicles are relatively uncommon, but when they do occur, they can cause a range of symptoms, including pain, swelling, and difficulty urinating. Another condition that can affect the seminal vesicles is obstruction of the ejaculatory duct. Now let's move on to the prostate. The prostate is a walnut-shaped gland that sits between the bladder and the penis. Prostatitis is one of the most common diseases that affect the prostate. Another condition that can affect the prostate is benign prostatic hyperplasia, also known as BPH. So now let me show you what happens to the seminal vesicles and the prostate when they are affected by diabetes. If you want to know more about diabetes,